Here in the Aerospace Medicine and Rehabilitation Laboratory at Northumbria University in Newcastle, we have been conducting research for more than a decade now, looking at how the human body is affected by going to space, whether that's in the microgravity environment of the International Space Station, or even going back to the moon in reduced gravity.
We know that being in microgravity is bad for you. We know that you're going to get weaker. We know that your bones will lose their mineral density. The way that we stop that from happening is by exercise. The same way we do on Earth. Exercise helps keep us healthy, and every minute matters.
So space agencies and private space exploration companies are looking to develop and find exercise countermeasures that are low resource, that can keep crew and also eventually customers healthy in space.
We research how to keep astronauts healthy in space, but more importantly, we research how to keep people healthy on Earth. We have a couple of devices that are our main focus in the laboratory. The one you can see behind me, which is called the variable gravity suspension system. And that's the way that we simulate going into space in the laboratory. It means that research is much faster and much cheaper than going into real space. The other one is the blood flow restriction device. That's the research focus of Dr. Luke Hughes, and it's one of the main elements that we add to exercise to make the exercise more efficient.
So my blood flow restriction research and work with NASA centres around two key teams. So the first being the astronaut strength conditioning and rehabilitation team. So I've been helping them for a number of years now to implement blood flow restriction exercise in actual astronauts returning from space to help improve their rehabilitation outcomes, and we've had great success with that so far.
So jumping has received particular attention as a potential exercise countermeasure in microgravity. So current spaceflight exercise countermeasures take around 2 to 2.5 hours per day to complete for astronauts. So the potential benefits of jumping compared to other forms of exercise is that it can be completed in a much shorter time frame, whilst potentially offering greater protection to the cardiovascular, musculoskeletal and sensory-motor systems. So by combining jumping with blood flow restriction might potentially offer a more effective exercise countermeasure when used in reduced gravity environments.
A key strength of the laboratory that has contributed to our growth and continued successes over the years working in the human spaceflight field is the team of staff and students.
Here at Northumbria University, we have people in social sciences, we have lawyers, we have engineers who build satellites, we have space weather, we have solar physics, and the entire human health team. We have university level students working with us across lots of different degrees. So between undergraduate and master's degree students, they'll come into the lab and they can either do a research project of their own as part of their degree programme, or they can come in as research assistants.
We are partnering with the UK Space Agency and Lockheed Martin Space to develop the North East Space Skills and Technology Centre, or NEST. This centre will put not just the university or the region on the map, but it will put the UK on the global map in terms of being leaders in the broad space research area. As part of NEST, there will be a dedicated space included for our laboratory, which will enable us to continue our journey onto bigger and better things in terms of looking at how the human body is affected by going to space.